I want to take a step back as in from disability above on care economy, which is a broader term used for the care sector. And how does, in a longer view of, how does you advocate from a public policy point of view through innovation and data?
Well, I think if you're talking about innovation and working on innovation, to me, that's largely a kind of a sector-focused activity. It's about organisations kind of discovering new ways of doing things and implementing them. I actually think it's the job of service providers to do that. I don't think you should go to government for support around that. I just think it's part of what you should do.
How do you drive public policy, not from a funding point of view, in terms of what should happen? For, in some sector, the data says that people with that kind of a balance sheet will fall in 3 years, or people will, those kind of expenditures, and then that person operating margins.
Yes.
So how do you drive, for example, if you have a portfolio of specific line or vertical of human services, and then you have some large providers, and you can, if you are seeing the balance sheet, which have been depleting for the last 4 or 5 years, and as a minister or as somebody who's managing that portfolio would intervene early before things fall. Something like that. That's one of the examples.
And we've been doing that. Like when we first started out, the roundtable was really just about by the sector for the sector. It was actually about service providers really getting their act together and putting the best foot forward and using data to really be able to do that. What we've realised is, in some cases, I've got 10 years worth of continuous data, and it's very deep and very powerful data, is we actually have insights into what's happening in service providers that government doesn't have access to. And so we've increasingly begun to see there's an opportunity there to support evidence-informed policy. And so we do that in a few different ways. Like we're producing white papers that really try to talk to what the current concerns of government are. We also, with our members' blessing, we actually will share the data that we've collected with government. And I can give you a couple of examples of that in a second. And increasingly we're finding that, whether it's the NDIA or the Department of Social Services, or in fact even with the recent NDIS review, there was a real interest in talking to us and understanding what data we had and what that data says. Because as policymakers, there's lots of data out there, but they don't get to see what's happening on the inside of organisations. So we produce white papers. We certainly will try and meet with policymakers, if you like, the bureaucrats, with ministers and ministers' advisors, to share what we're finding early, so that they can actually then use that information to drive better policy.
Going on to the on one of the white papers, and one on the NDIS review, and you talked about there's a pricing piece which is been discussed, and then multiple levels of pricing and all of that. So you just talk more on the pricing views and your views on that.
Yeah. So one of the benchmarking groups that we have is around pricing and workforce. Sorry, it's about financial performance and workforce. And that gives us real insight into the actual financial performance of organisations. The NDIA has, particularly when it comes to core supports, so support independent living, one-to-one support and so on, they have a cost model, which is basically a formula they use to try and work out what the price should be. And ideally that model is really informed by the performance of the sector, so data from the sector. With the data that we've been collecting around financial performance, and when we plug that into the NDIA's cost model, what we're seeing in our data is that the assumptions that the NDIA has been making don't fit with the actual experience, the actual costs of delivery of service. And so and there's several areas where...
So I'm keen on understanding those. What are the parallels? So if the NDIA cost model assumes corporate overheads at X percentage, and then what are the real...
Yeah. So exactly that. So there's lots of things that go into the cost model, but kind of there's 2 or 3 kind of cost inputs which make up most of the cost. And certainly overheads, like the money that's not spent on direct service delivery, is a big part of that. And the agency's assumption in the cost model is that the cost of everything that you do, except for paying for your direct support staff and their frontline supervisors, will be 12.5% of on top of what you're paying. And our benchmarking, which has now been running for over 5 years, has shown that even for the most efficient providers, those the 25% who have the lowest corporate costs, overhead costs, operating expenditure costs, however you want to define it, even the most efficient 25% can't get below 20%.
No.
So you've got 12.5% as a target.
7.5% gap.
A 7.5% gap. And when we're seeing no evidence that that's reducing over time. So we think that 12.5%, which is actually not based on any data from the sector whatsoever, it's actually a number that the agency sourced from elsewhere, that is actually not supported by any evidence. And so what it means is that, in this case, 80, 85%, maybe 90% of all the organisations that benchmark with us are not even close to that 12.5%.
And are there any operating margin assumptions or benchmarks?
The operating margin is 2%.
From the cost model?
Yeah, on the cost model. So that's after all the other costs, there's a 2% margin. When for 3 years in a row, 65% of all the benchmarking organisations have incurred a loss, it's a bit meaningless to talk about an operating margin. Like these organisations have been losing money year on year. So that's 2/3. 2/3 of the group are losing money. And we've even double-checked this looking at a broader data set, which is to go to the ACNC, the Australian Commission on Charities and Not-for-Profits Commission. And they're, for all not-for-profit disability service providers, 50% or thereabouts made a loss in financial year 21-22. We don't know what 22-23 looks like yet because that's all based on